We don't bite real hard.
Thomas business.
Is there any press people out there yet? If they are,
Okay.
Terry, would you look, see if there's any press people out there?
They're probably not.
Okay.
They'll just watch the stream.
No, we discussed that you didn't get the tickets, but
Yeah.
You are not significant if you're worried about that, because we should say that we weren't going to have anything.
we're going to wait and see if there's any press people here. There's none?
I think they'll just watch the
They're
stream.
gone. All right. So let's get
They can catch it.
reconvene here. And who's your spokesman? Who's going to be the spokesperson here?
Here's a microphone.
Please introduce yourself so we have it on tape. And we are being streamed live, so go ahead.
Okay, my name is Jen Foberg, and I'm the manager for the Office of Child and Family Services. And my territory is the northeast corner of the state, so I'm the direct supervisor for the WIC office downstairs.
I am Cassie Deffenbach. I am the Assistant Administrator for our Office of Disease Prevention for the Department of Health. I am Assistant to the Administrator, Bonnie Jameson, located in Pierre. We have approximately 35-40 staff throughout the state, and currently we have 2 DIS located in one of the offices here in Watertown.
Okay. So, with that having been said, please state your request. What do you want?
Okay. Do you want to go ahead and...
Yeah,
The actual...
Yeah, I'm sorry. Just for the YouTube stream, we have to have the
we are hoping to relocate our 2 disease intervention specialists from the current Watertown location down by Ramcota 212 into the courthouse with our WIC nurses to co-locate for client services. And that would be temporary. There would be no changes for the possibility of future relocation. And we would be willing to pay rent as we do for our dietitian based on how many people we have coming. I've got 2 disease intervention specialists that we'd like to relocate here, and then also a inspector for our health protection office for the Department of Health. And we just want to co-locate to ease client services and be more united.
All right. And that request would be for sharing the facilities here in the courthouse. And you know that we're in the process of probably moving, so this agreement or contract would be from now to the end of the year. Is that what we're talking about?
Well, I don't know about the length of the agreement. I guess we can write it how we want to, but you're aware that we're talking about moving the nurse's office out of the courthouse in probably March or April next year.
That is correct. We are aware of that, and we would be co-locating with them at that time as well.
Okay, so and in my discussions with Scott,
thank you.
The space we identified is a little bit bigger than the current nurse's office, and so you guys are good with fitting all of you in there. So we're talking about basically, how many people we have there now with just the nurse's office and the dietitian?
Well, right now in the office downstairs, we have 2 nurses, a dietitian, and 2 clerical staff.
Okay, so that's 5 people and adding 3 to that. And so...
This would be a total of 8.
Right, then. And so that would...
And what we have done downstairs, and if you want to walk through to see, is we've moved our staff and we've opened up an office space and kind of a storeroom for their staff if, approved by the commission, that they could use for the time being.
Okay.
And it takes away then we no longer are able to use the conference room because that's probably where their staff's going to be.
Yeah.
And one of the questions that the staff had, and I don't know if this is the time to talk about it, is how much of the things that they store in the basement would still be allowed to be stored in the basement with the potential move in March or April, if that's something that you'd like them to take with them when they go to that building.
We hadn't really talked about
that.
I guess we have to talk about that. Right.
So I guess it's kind of 2 different.
Yeah, that's
topics.
a different thing. Yeah, but we do need to keep it in mind as we get ready to do that, because I'm not excited about looking for more office space, and then the other thing, and this probably doesn't pertain to the current agreement we're talking about for the courthouse, but how do we if you guys are going to pay for basically half of that lease, then working out how that lease is written is the tricky part. And so, and we need to talk to the lawyers.
At this point in time, we have nothing in front of us to vote on, and so how long do you think how long before we can have something?
For that,
First, we need to decide whether we're even going to allow this or not, and then you go forward with the
Actually, there is
lease.
action in number
Yes.
5, action on a request to
Yep.
temporarily lease office space
Yes.
And
in
then-
the courthouse.
and then we'd have
That's
it-
what's on the agenda
yeah,
right
that's
now.
what we're talking about now.
All right, so we can make a move on that part. Does anyone wish to do that?
I have something to bring up at the appropriate time.
Do we need to make a motion and then go into discussion?
Yes, make a motion, and then we'll go into discussion.
I'll make that motion.
Okay, we have a motion by Hatton, second by
I'll second it.
Gable. Now we'll open it up for discussion. Charlie?
Mr. Chairman, we've been approached by a couple of different people and given it some thought and cool things, but you're with the WIC program, is that correct?
Right.
And you're with the
Disease prevention.
disease prevention. You're going to both be in the same area. When I think of children and possible cross-contamination, we get down to the jail, we can't have youth walking by our doors, we got to keep them closed because that might be a bad influence on our youth, but yet we're going to take people that might have some kind of a communicable disease and bring them into exposure where there is going to be some youth in that direction. And taking that into consideration, I've got a personal thing which I'll share later. I would be against that.
Mr. Chair, I guess I would also like to know what sorts of duties, what sorts of things are you going to be performing as your disease prevention?
Our disease intervention specialists are responsible for testing clients for STDs. We provide treatment for TB, not necessarily active TB. We don't treat active TB within our office. We go to their home and provide that treatment. We also, a lot of our stuff that we do is over the phone. We do interviewing for clients for different diseases that are reportable in South Dakota, which would include Shigella, Salmonella, all of these different diseases. And many of the diseases that we bring in for treatment are not necessarily airborne or diseases that are caught easily. These clients come in, and many of our clients are for STD treatment. So we do test them, and then we also, depending on our protocol, can treat if they're asymptomatic, or we refer them to a physician. We connect them to services, we provide them resources, we let them know of our WIC availability as well, those resources, DSS. We do work, I would say we serve a lot of the same clients as our WIC nurses. We do not serve pediatric clients. We serve everyone 18 and older because of Title X with family planning. Those are clients that we can no longer see. So those are taken care of by their provider.
So you said you test for certain STDs. How do you perform those, and where do you plan on doing that here in the courthouse?
With STDs, we do a urine sample, and then within the courthouse, we've got the bathroom that we would do the urine analysis or specimen.
A separate bathroom or a public bathroom?
Are you guys? It would be the public bathroom.
Okay.
So to follow that line of questioning, so excuse me, Mr. Chairman, so is there any risk about any, communicability as a result of using a public restroom?
No, I would say the risk for transmission using the same bathroom as someone who has a communicable disease such as chlamydia or gonorrhea is very low. I'm not saying that it could never happen, but it is very low.
Any other questions? Charlie?
Now, I'm going to go back to my first point, and obviously I'm opposed to this. When I go to my dentist, there's risk of HIV.
Turn your mic. Thank you.
Excuse me. When as I'm opposed to this, but to reinforce a point, when I go to my dentist, there's a low chance that I might or be infected with HIV, and then we can all go back to how it used to be going to the dentist. Now we've got rubber gloves and mouthpieces and et cetera, et cetera. We have measles. We're contagious before it actually comes about. We have a cold. It spreads before we know we've got a full-blown cold. And for those reasons, I would be opposed to this union.
All right, anything else? Any other questions?
So I think it might be good just to hear the kind of precautions, the prophylactic measures you take to...
I will also mention, too, we do blood draws as well for HIV and syphilis. Those are also things that we do. We wear our gloves. We use standard precautions with anyone that we have any contact with. We wash our hands. We ensure that all equipment that we use is in a new package. We don't reuse any of our needles or equipment or tubes or anything like that. So all of the equipment that we use is prepackaged or never been used before. So that is how we prevent transmission of any of those diseases. If in the courthouse, we will ensure that we wipe down any surface that we use, just as we do at our current location. We have exam tables that we make sure that we clean between every single patient. We've got drapings that we put down for all of our supplies so we don't contaminate countertops, and those we wipe down as well after we use that.
All right.
Mr.
Any
Chair,
more?
besides the fact of the disease portion of it, space-wise down there, they're already, then we're going to lose a room for their nursing mothers with the children because you'll have to utilize that. So we already are pretty cramped with what we have. So that means we're going to lose more space.
I'm probably, just chiming in one more time here, I'm probably more aware of diseases and infections, and I don't know your background and your background, but my wife used to run a laboratory hospital in Mobridge for a number of years, and even though you have strict conditions and protocol and books on how to procedure manuals, there still was times of infection that did happen.
All right, anything else? Any other comments?
I would have a question. Is this something that we should be running by our insurance company because of our liability for?
Yeah, that's a good point.
I don't know. I have no idea if it'd be a liability question for us or not with our current carrier.
Maybe I would...
Because we are using a public restroom, and it's unisex. I mean, it's open to anybody.
If we take a vote on it, can it be contingent on the fact of what the insurance company says? I mean, we don't really know how this is going to go yet, or?
I don't know if I would take a vote
Well,
before finding out these
I
answers.
think the action before us is just a general agreement that this is okay. Then there'd be some kind of an agreement that we draw up with the lease and all that stuff. But but before drawing up the lease, if you want to, it makes sense to add that to the motion. I mean, to say pending.
Well, we have a motion on the floor right now.
Yeah.
Amend the motion if we needed to.
Would you wish to
Well,
amend
okay,
the-
you've taken a motion, you've made a motion to enter into a temporary lease. You're going to have to come back and approve a lease agreement
Right.
in a separate motion.
Exactly.
Sure.
Once the lease
Yeah.
agreement's been reviewed by the
Authorized
state's
to
attorney and those type of things. So, I mean, yeah, you can leave the motion the way it is today, knowing full well that you still have to approve a lease
approve another
agreement.
lease.
All right,
Yeah.
you heard the explanation. Is there any more discussion? Seeing none, all in favor indicate by saying aye.
Aye.
Opposed, same sign.
No.
No.
Okay, we have, let's ask.
Roll call.
Roll call vote, okay?
Commissioner Gable,
Aye.
Commissioner Waterman,
No.
Commissioner Johnson,
Aye.
Commissioner Van Duzen,
No.
and Commissioner Hanton.
No.
So that motion fails on a 3-2 vote.
All right, so next step would be, I don't know what the next step would be. You know?
I think
It's dead.
That's it.
It's dead, yeah, we voted it down, so, yeah, I'm sorry, but that's the way the vote goes. All right?
Yes, thank you.
Well, thank you for coming up and sharing with us.
now for the this was just about the courthouse, so, I mean, I guess it's still out there. I mean, am I
Yeah.
wrong? It's still out there for the next, for the...
This was for this facility right here.
Yeah.
Right now.
But that's complicated. The one after the move's going to be complicated because we're leasing, and then you're talking about a sublease or maybe two separate little leases or something that we have to figure out, so, anyway.
All right. Okay, thank you.
And I don't mean to jump your agenda, but do you have any questions for me about the potential move?
I think, from what I talked to Scott Gregg yesterday, so I think we're okay on that one as far as whether it's just nurses or both of you someday, that space that we've been talking about is okay.
Right.
That lease is in the works, but if we'll probably have to deal with as separately whether or not you'd be both together in that space. So.
Right, and I think, I mean, the way I understood it, it would be, up to the commission.
Yeah.
And the county.
So if we deal with that again, and then that we sit in, if we were okay with putting you together in that space, then we'd have to work on the lease. So that might be, I'll have to talk to the property owner and see what and see what that looks like. But I think, from what I understand, you guys were happy with that space. You saw it.
Yeah,
Jen.
Office of Child and Family Services thought it was a great space.
Okay, all right.
All right, good.
Thank you for coming.
Thank you.
Okay, thank you.
Thank you.
Thanks.
All right, anything else?
I move that we adjourn.
We have a motion to adjourn, motion by Hatton, second by Van Dusen. Any discussion? All in favor indicate by saying aye.
Aye.
Opposed, same sign. We are adjourned.
See if Debbie has vouchers for you. Maybe you want to shut off the live streaming before you...
I think you're saying, speaking up, Joe.
Do you want to shut off the live streaming?